Welcome to today's webinar on the topic November, the month of hope, awareness and action against cancer. Brought to you by DS Research Foundation. DS Research Foundation works on principles of ancient Ayurveda of nutrient energy to fight against cancer. It has a long journey in treating cancer patients with its centers across India, that is Varanasi, Guwahati, Kolkata, Mumbai, Bangalore and Hyderabad. My name is Manjari Bajpai, working as a dietitian at DS Research Center, Varanasi, and I'll be your host for today's session. Before we begin, let me quickly go over for a few housekeeping notes, and that is this session will be recorded, and feel free to ask questions at any time using the chat, and we'll address them after the session. And if you experience any technical issues, please let us know in the chat box. So now let's dive into our today's topic. As we all know that the month of November has its significance in raising awareness about several types of cancer. November is said to be the time to focus on understanding, supporting, and advocating for those affected by cancer. It's dedicated to spreading knowledge, encouraging early detection, and promoting healthy lifestyles. Specifically, November is recognized as Lung Cancer Awareness Month, that is shedding light on the importance of lung health and advancement in treatments. Pancreatic Cancer Awareness Month, highlighting the need for early detection and continued research into this challenging disease. Stomach Cancer Awareness Month, emphasizing prevention and importance of knowing the symptoms. Also focusing on men's health issues, including prostate cancer and testicular cancer, alongside mental health and wellness. Each of these observances is a reminder of the collective fight against cancer and the importance of awareness, education, and community support. At DS Research Center, we believe in power of prevention and early detection. Throughout this month, we had been sharing resources, stories, and expert advice to help you learn more about prevention, detection, and the progress being made in cancer research. In the same series, today we are here with our two eminent speakers to talk on some important aspects of various cancers. So our first speaker, we are thrilled to have us with us today, Dr. Gaurav Das, MCH. He is Professor of Surgical Oncology, lead surgeon of GI, HPB, GU, Pediatric and Bone and Soft Tissue Tumors. Dr. B. Borooah Cancer Institute, he is working over there. It's a unit of Tata Memorial Center. He has 12 years of experience in oncology and has more than 50 index publications and book chapters. We welcome you, sir. Our another speaker for today is Dr. Priyanka Chakraborty, BAMS MD Kayachikitsa, Ayurvedacharya at DS Research Center, Guwahati, Medical Officer of Ayurveda at Rangmati PHC under the disposal of Patharkind BAPHC, Karimganj, Assam. She has been Senior Research Fellow in Ayurveda in Central Ayurveda Research Institute, Guwahati under NMPB Grant in Aid Ethnobotany Project. She has various research articles published in national and international journals. To name some is International Ayurvedic Medical Journal in 2021 August. She has written on clinical evaluation of the nephroprotective effect of polyherbo-mineral compound in CKD. So we welcome you, ma'am. And to start with, since Dr. Das is with us, to start with, sir, we'll start with the kind of lung cancer. Basically, this was the Lung Cancer Awareness Month, and we had been doing several events in the schools and colleges regarding this. I just wanted to know for our listeners that what are different types of lung cancer and what are the risk factors of lung cancer?
When we say that what are the types of lung cancers, usually we mean the histological variants, like what histologies they show. So the most common types of lung cancers that we see, primary lung cancers that we see, are the non-small cell lung cancers and the small lung cell lung cancers. And non-small cell, that includes the squamous cell variant as well as the adenocarcinomas. They are collectively known as the non-small cell lung cancers. Apart from that, all of these have many other subtypes. Each one of them has at least 5 to 10 subtypes. And there are very uncommon varieties as well. And we can also see other types of cancers like sarcomas and lymphomas as well. So that addresses part 1 of the question. And the second question, I think, was related to the risk factors. Now, as we all know that tobacco smoking is one of the primary causes of lung cancer. And literature shows that almost like 85 to 90% of lung cancers are attributable to smoking, whether it is first hand or second hand. And apart from that, we have environmental pollution and certain other factors like, let's say, radiation. It can be background radiation like radon exposure, or exposure to certain pollutants like asbestos, which are known risk factors for cancer.
Sir, coming to these risk factors, basically what we have heard about the radon and the asbestos, ये कितना ज़्यादा prominent है अभी के उसमें? Radon exposure तो ज़्यादा मेरे ख्याल से नहीं है हम लोगों के साथ.
No, radon exposure is like, it's very, there will be background radon gas exposure in any part of the world. But then there are certain areas in the world which have little bit higher than normal. So that part, it can be determined only with studies to detect how much radon background radon exposure is there. So what is actually relevant is addressing the primary cause of lung cancers, which is smoking. So if we can curtail the smoking habits in our population, lung cancer cases will actually come down. And this was the case in the early 19th century. Before that, when smoking was not there, lung cancer was not even in the top 10. Now, after the 19th century, when this tobacco industry grew and smoking habits became very rampant, lung cancer has become #1. So that is the main problem.
So in that case, that is what we call passive smoking, that non-smokers are also very much prone to these lung cancers.
True.
मतलब वो कुछ करे नहीं तो भी उनको lung cancer हो सकता है.
True. Actually, one study was done in the institute where I did my M.Sc training in South India, near Chennai. So between 2003 to 2007, they looked into how many non-smokers actually developed lung cancer. So they found, surprisingly, that 40% of the population did not have a history of first-hand smoking. They could have possibly second-hand smoking, but they were not first-hand smokers. And similarly, from Rajiv Gandhi Cancer Institute in North India, they also found something like 40.6% of them not being first-hand smokers. So that is something alarming.
Okay. Coming to you, Dr. Priyanka. My question to you is for the pancreatic cancer, basically. What is pancreatic cancer and how does it develop, and what are the primary risk factors of it?
Actually, pancreatic cancer has today become one of the 4th common cancer in India. And it begins when our abnormal cells in the pancreas grow and divide out of control and form a tumor. It actually develops when a cell in the pancreas gets damaged because of the risk factors or the causative factors of it, and it leads to damage the DNA further on, and which causes that very single cell to grow and divide rapidly, becoming a tumor that actually does not have the normal characteristics which our normal cell has. It doesn't have, and it proceed on mitotic division, or you can say abnormal cell division. And yes, there are various risk factors of pancreatic cancer, but mainly I would say, like on layman words, I will say the ABCD of pancreatic cancer. Like first, the most common ABCD is like A, this alcohol. Till now, the maximum patients which are being diagnosed as pancreatic cancer has a history of taking alcohol. So first, alcohol is one of the main primary risk factors for pancreatic cancer. The next comes that is being overweight. Next comes the chronic pancreatitis. It means chronic pancreatitis means if the patient is having pancreatitis for a very long time and it is not being treated well, or if the patient has just been overlooked his or her disease. For that, in chronic pancreatitis also, the chances of getting cancer comes. Next, D is the diabetes. Yes, diabetes patients are high, those diabetic patients who have prolonged high uncontrollable diabetes, hyperglycemia, prolonged hyperglycemia, uncontrollable. Yes, they are the risk factors for getting pancreatic cancer. And yes, having diet, like there is no good diet, and the person is not following any good diet, and he is like having sedentary lifestyle, also sedentary lifestyle, these peoples are more prone to having pancreatic cancer. And lastly and most important, that's the family history. Family history is also there, because if there is any family history of pancreatic cancer, this also have a has imparts a risk factor in getting pancreatic cancer.
My question to Dr. Das, आपको ऐसा लगता है कि जो लोग ये जिनको ये गलत आदतें हैं स्मोकिंग की या ड्रिंकिंग तो जैसे मैम ने कहा कि होता है, उसकी वजह से पैंक्रियाटिक कैंसर है, पर जो लोग ओवरवेट नहीं है, जिनको ड्रिंक करने की आदत नहीं है, फिर भी उनको पैंक्रियाटिक कैंसर है, और वो भी यंग एज में, व्हेन द पेशेंट इज नॉट डायबिटिक एज वेल, तो ये प्रॉब्लम क्यों हो सकती है?
No, we have to understand that cancer as a per se has many other causes which are not yet known properly. If we have cancers in young age, then most of the times we suspect that there could be a hereditary cause, whether it is due to known mutations or unknown mutations. Usually for most cancers, the known mutations are accountable for like around 10% of most cancers. But then there are many other mutations which are not known and not yet discovered, and these are part of the familial cancer syndromes. So that also accounts as a whole that there will be around 20% cancers which are because of this kind of known or unknown mutations that are mostly the causes of cancers occurring in early age without other environmental risk factors.
Okay. अच्छा, coming to lung cancer again. जैसे बहुत बार तो ये देखा गया है कि लोगों को पहले टीबी की दवा चलती है, ट्यूबरकुलोसिस डायग्नोस होता है और उसके बाद फिर पता चलता है कि नहीं ये तो कैंसर था. सिमिलरली इज द केस विद द न्यूमोनिया. तो क्या ऐसा हो सकता है कि लंग कैंसर कैन शो अप एज न्यूमोनिया एज वेल?
Yeah, it's a very nice question actually. So what studies have found, population-based studies have found, is that if in a general hospital we look into the patients who are admitted and walked up for pneumonia, then about 2% of cases are actually due to cancer, lung cancer. But when we know someone who has a diagnosis of lung cancer, then almost nearly half of the patients will have some clinical or radiological finding of pneumonia as well. So pneumonia, yes, it is one of the presenting symptoms of lung cancer.
Okay, and can it be detected through blood test? ऐसा कोई ब्लड टेस्ट है जिसमें ये पता चल सकता है? क्योंकि बेसिकली जितना तक मैं समझती हूँ ये तो म्यूकस और इसका काम है, तो ब्लड टेस्ट में ऐसा कुछ है?
Yeah, as a direct answer, no, because usually lung cancer is mostly diagnosed based on clinical symptoms and by test, and these are mostly imaging tests like chest X-ray, CT scan, PET scans, or like if we do sputum cytology, we may find malignant cells, or we do something called bronchoscopy where we go into the airway and find out the disease. So these are known ways by which lung cancer is detected. But of course, there is something called a liquid biopsy that we do for advanced lung cancer. Sometimes if biopsy is not possible for whatever reasons, then a blood test called liquid biopsy, which will detect the DNA from the dead tumor cells, and on which basis we can run various molecular tests. So technically it is there, but for all practical purposes, blood tests are not useful for the diagnosis of lung cancer.
And this liquid biopsy is also not very common with this.
No, because you asked specifically, like, is there any blood test available?
Yeah.
But for practical purposes, blood tests are not used for the diagnosis of lung cancer. Only when we are not able to take a biopsy for a very frail patient or something, like it's in a very dangerous location where some complications can happen. In such cases, yes, in advanced cases, we can take liquid biopsies to do molecular tests based on which we can do some targeted treatment. that thing is there, but then it's mostly for the oncologist. For the general public, it is like no, it is mostly detected with clinical and radiological and endoscopic test.
अच्छा, एक क्वेश्चन और दिमाग में है कि जो हम लोग प्लूरल इफ्यूजन जब होता है तो जो प्लूरल फ्लूइड का हम लोग साइटोलॉजी कराते हैं उसमें भी पता चलता है अगर उसमें मैलिग्नेंसी है तो कितने % चांसेस होते हैं लंग कैंसर होने के? ये जरूरी है कि अगर प्लूरल फ्लूइड में अगर मैलिग्नेंसी दिख रही है तो लंग कैंसर होगा ही?
Yeah, pleural fluid, if pleural fluid contains lung cancer cells, it is stage 4. So अगर pleural fluid में lung cancer cells मिल रहा है, that means the patient has lung cancer. But we should also know that pleural fluid में अगर cells नहीं भी मिल रहा है, तब भी lung cancer हो सकता है।
lung cancer होगा,
क्योंकि उसमें sensitivity 100% नहीं है।
And so then treatment and preventable ways for this?
Yeah, treatment of lung cancer, actually we have a lot of modalities for treating lung cancer. And this includes surgery, it includes systemic treatment, it includes radiotherapy. Systemic treatment means traditional chemotherapy, there is targeted therapy, there is immunotherapy. For practical purposes, if we detect a cancer early, that is stage 1 and stage 2, surgery has a role. And surgery also has now got a role in even some forms of stage 4 cancers. We call that oligometastatic lung cancer. And if it is in advanced stage like stage 3 and stage 4, is mostly the treatment is with systemic treatment. And in stage 3, radiation does also have a role. So this is overall in a common way, in layman's term, this would be how we manage lung cancers.
कमिंग टू डॉक्टर प्रियंका, मुझे ये पूछना था कि हम लोग जैसे यहाँ पे बात करते हैं आयुर्वेद में इसमें कि जो म्यूकस फॉर्म हो रहा है दैट इज द फूड ऑफ कैंसर सेल्स, और लंग कैंसर में म्यूकस फॉर्मेशन बहुत होता है। तो जो अभी जैसे सिद्धू का एक आया था कि हल्दी है और इससे है उनके पेशेंट को बहुत फायदा हुआ है कैंसर में, आपका क्या कहना है कि म्यूकस कम करने के लिए और लंग कैंसर में आयुर्वेद का कितना बड़ा रोल है? मैम आपने क्वेश्चन सुना? प्रियंका मैम, आर यू देयर?
यस,
आई वाज आस्किंग कि जो म्यूकस फॉर्मेशन जो लंग कैंसर में है उसमें आयुर्वेद का कितना रोल है? बिकॉज व्हाट वी बिलीव कि म्यूकस इज द फूड ऑफ कैंसर सेल्स, तो उसकी वजह से तो फिर कैंसर और तेजी से ग्रो करना चाहिए। तो हमारे आयुर्वेद में जैसे अभी सिद्धू का एक आया है वीडियो, हालांकि वो बहुत उसको ट्रोल हो रहा है कि ऐसा नहीं हो सकता है, तुलसी और हल्दी और ये मिलके कैंसर खत्म नहीं कर सकते, पर आप एज आयुर्वेदाचार्य आप क्या कहना चाहेंगे?
पहले तो ये जो म्यूकस का जो है, म्यूकस जो मेन जो प्रॉब्लम होता है लंग कैंसर में, जो म्यूकस फॉर्मेशन होता है, वो जो उन्होंने जो वो लोग जो बोलते हैं कि नहीं है, वो टोटली एक रॉन्ग मतलब एक नोशन है। यस, आयुर्वेदा हैज इट्स ओन पावर to destroy the mucus, excess mucus production. Yes, mucus is important. Mucus helps in the मतलब ब्रीदिंग करने के लिए म्यूकस मेम्ब्रेन वो सब चाहिए होता है, बट लंग कैंसर में क्या होता है, वो एक्सेस प्रोडक्शन हो जाता है। हम आयुर्वेदा के मेडिसिन क्या करते हैं, जो आयुर्वेदिक मेडिसिन है, जो हर्बल मेडिसिन है, वो डायरेक्टली जो हम लोग का हमारे मेडिसिन में षड्रस होते हैं, षड्रस, ईच एंड एवरी मेडिसिन हर्बल जो प्लांट्स है हम लोगों का आयुर्वेदा में, वो है उन सब में षड्रस है, मतलब मधुर, कषाय, आपका कटु, तिक्त, लवण, ये सब षड्रस होते हैं। तो हम लोग का जो कषाय रस जो होता है, जो मेनली कषाय रस प्रधान मेडिसिन होता है, वो मेनली हम लोग लंग कैंसर पेशेंट्स में देते हैं, क्योंकि ड्यू टू द एक्सेस प्रोडक्शन ऑफ आपका जो एक्सेस प्रोडक्शन ऑफ म्यूकस जो होता है उसमें, ठीक है, वो, और कषाय जो है वो एंटी इंफ्लेमेटरी भी है। सो आप कनेक्ट कीजिए, जो एक एंटी इंफ्लेमेटरी, जो इन्फ्लामेशन पहले से लंग में हो रहा है ड्यू टू द कैंसर सेल्स जो बाकी सेल के साथ, बाकी एंटीबॉडी जो हमारे बॉडी में है उसके साथ एक लड़ाई जो हो रहा है, उसके एक फाइट जो हो रहा है, जिसमें एक्सेस म्यूकस प्रोडक्शन हो रहा है, जो एक इन्फ्लामेशन हो रहा है, वो हमारा जो आयुर्वेदिक मेडिसिन है, मतलब जो टर्मरिक बोलिए या फिर कोई भी हम लोग का जैसे कुटकी बोलिए, ये सब मेडिसिन, कुटच बोलिए, ये सब मेडिसिन आपका मतलब जो इन्फ्लामेशन है वो एंटी इन्फ्लामेटरी इफेक्ट देता है, प्लस एंटीऑक्सीडेंट है। मतलब जो सेल्स मर गए हैं उसको, जो सेल्स मतलब पहले जो ट्यूमर सेल्स है वो तो मर गए हैं, उसको ठीक करना, प्लस वो जो उसके साथ जो बाकी सेल्स भी मर रहे हैं उसको ऑक्सीजन देना, उसको फिर से जिंदा करना, टू मेक द डेथ सेल्स और द गोइंग ऑफ डेथ सेल्स टू मेक इट अलाइव। एंड वो एक प्रोसेस, वो एक फॉर्मेशन का भी हम लोग डिप्लीट करते हैं थ्रू आवर मेडिसिन एंड आयुर्वेदा मेडिसिन। वही
Dr. Das, your take on this, because I have my research on Tulsi basically. Here I have done, and with the grace of God and everyone, I got second prize in IPN India International Congress for Nutrition. We have that Congress, and there, because I have tried Tulsi in 3-4 kind of patients, like in liver cancer patients as well as lung cancer patients. A simple concoction of Tulsi and ये ब्लैक मिरी जो होती है, ब्लैक पेपर, वो है, या ओनली तुलसी रस from the leaves of tulsi, they actually reduces the production of mucus. That is what I have seen. So do you have come across any of such kind of things? Like, you are in the modern medicine practice basically, and we as dietitians practice both of it, modern medicine as well as Ayurveda. So any take on that?
Yeah, I'm not an expert on this, but then we do use what we call mucolytics and bronchodilators for patients who have obstructive symptoms because of lung cancer. So this can probably decrease the symptoms related to pneumonia because of lung cancer per se. But it would be difficult for me to believe that this would actually lead to a cure of lung cancer. Definitely the symptoms would probably respond to such mucolytics and bronchodilators.
So I'm saying that these things actually reduces that mucus formation and makes the patient feel better. True, I'm not saying that it cures lung cancer, but it relieves the patient.
True, just like we use mucolytics and bronchodilators.
Exactly, exactly. Okay, so now coming to stomach cancer, that is also what November is called for. So basically, how we come across saying that a person has got stomach cancer, क्योंकि आजकल lifestyle सबका बहुत खराब है, हम सब लोगों को एसिडिटी की प्रॉब्लम है ही है, पेट किसी का ठीक नहीं रहता, तो और कभी कभी उसकी वजह से अल्सर और अल्सरेटिव कोलाइटिस होता है, तो स्टमक कैंसर तक कोई कैसे पहुंचता है और ये हम कैसे पता कर सकते हैं?
Now there are a few things that we need to know about stomach cancer. First of all, in the early stage, stomach cancer will produce very vague symptoms. There are no specific symptoms of stomach cancer when it is in the early stages. You will mostly have symptoms which are related to gastritis. People will just dismiss it like the gastritis and take pain, those pantoprazole, the proton pump inhibitors, or those kind of medicines, antacids and all. Or they may have a poor appetite, or like say they have problems like indigestion and all. Or sometimes they may have anemia because of chronic blood loss from the bleeding ulcer. Only in the advanced stages, when they have profuse bleeding, like they may manifest as hematemesis or melena, or they may have pain abdomen, or they may have obstructive symptoms like that lead to vomiting, then already the tumor is big enough to be advanced. Early cancers are mostly with vague symptoms, and that is why stomach cancer carries a lot of mortality when in most parts of the world, because it is detected late. So that is one thing. Second thing is we should understand what are the risk factors for this stomach cancer. Now we know that Helicobacter pylori, it is an organism which is very often blamed for causing stomach cancer. There is a definite pathway by which it causes changes in the stomach mucosa and eventually leads to gastric cancer after a lot of accumulation of mutations. So that actually has a name also. We call it the Korea hypothesis. So it is one of the most common form of common risk factors for development of, and unfortunately in the general population, a lot of people, almost like more than half of the population, will have Helicobacter pylori. So one very easy measure of decreasing stomach cancer prevalence would be to decrease for effective clearance of this Helicobacter pylori infection when it is detected. And there is a very simple regimen to clear this bacteria. And the other sides of other risk factors would be like alcohol consumption, smoking. All these are modifiable risk behaviors which we can easily address with various awareness campaigns. So then one more important thing is the salt cured and the smoked food. Now these are related to our traditions. In many parts of India, like most of the northeast states, people take a lot of pickled or like salt cured food and a lot of smoked food. Now these are known risk factors. These are there are a lot of carcinogens in such kind of food. And in a long term, we should try to address this kind of behavior and decrease the consumption of such kind of food if we have to realistically bring down the burden of stomach cancer. So these two, one is Helicobacter pylori eradication, and second thing is addressing the modifiable risk factors. That would go a long way in decreasing the incidence of gastric cancer.
सर जो ये बैक्टीरिया जो है आप कह रहे हैं कि अबाउट 50% या 80% लोगों में ये मिलता ही है, तो इसको हम
very common in the general population.
So how to get, ये कैसे पता चलेगा कि किसी के में ये है? उसका भी तो कोई सिम्टम होगा, तभी तो हम उसके जांच के लिए जाएंगे.
हाँ, वो जो gastritis का symptoms होगा. Patients having symptoms related to gastritis for a long duration, for months and months, they can easily do test for Helicobacter pylori. There are invasive methods as well as non-invasive brain tests by which we can easily identify whether the person has this kind of infection. And if it is there, it's very easy. You take a course of 7 or 10 days and the bacteria disappears from your gut mucosa.
So that can be a kind of preventable measure to
yes.
Get away from the stomach cancer.
Not all patients will develop cancer, but a good fraction of these patients who have a chronic Helicobacter pylori infection will go on to have it after, let's say, a few years, 10 to 20 years.
Okay. आपके हिसाब से इसका मतलब जो चूल्हे पे रोटी बनती है वो नहीं खानी चाहिए?
No, that is not smoked food. Smoked food is like you take smoked fish, smoked meat, all that is
okay.
Charcoal directly.
Okay, that kind of food.
That kind of food. That contains a high amount of nitrosamines. These nitrosamines are blamed for producing not only nitrosamine, there is something like polyaromatic hydrocarbons and nitrosamines, which are directly blamed to cause DNA defects.
Okay. Coming to you, Dr. Priyanka, what can be the standard treatment for stomach cancer as per Ayurveda? अगर हमको किसी पता है कि किसी को स्टमक कैंसर है, तो हम सबसे पहला क्या कर सकते हैं उनके ट्रीटमेंट में? क्योंकि उस वक्त एसिडिटी और गैस्ट्रिक का सबसे ज्यादा प्रॉब्लम होता है. तो एज पर दी फूड, मतलब फूड इनटेक में तो हम उनको वैसे भी सेमी सॉलिड और सेमी एलिमेंटल डाइट देने की कोशिश करते हैं, लेकिन एज पर दी ट्रीटमेंट हम क्या कर सकते हैं?
एज पर ट्रीटमेंट हम लोग ऑब्वियसली डाइट तो फॉलो करना ही पड़ता है. एक अच्छा न्यूट्रिशन देना पड़ता है टू स्टमक कैंसर पेशेंट्स, बिकॉज दे हैव as our doctor has said, Dr. Gaurav has said, they will be having gastritis, history of gastritis. So it will be like उन लोग का खाना पीने का कुछ प्रॉब्लम होगा ही पहले से ही. So कुछ पेशेंट्स को ऐसे भी देखा है, they are taking PPI, proton pump inhibitors, for a longer time due to as they have been diagnosed and advised to take PPI for forever like that. That those patients are also there. They are taken. Yes, we have to tell the patients to stop taking those PPI, because PPIs have also side effects to cause cancer. Okay, prolonged taking PPI also can cause cancer. On the way of treatment, in the way of approaching the patient towards treatment, first we have to explain to them, we have to say them, if they are taking PPI daily, we have to just stop them taking PPI, because PPI is not a solution of not having, of not getting gastritis or of curing from gastritis or something. Okay, and yes, as I have said, diet is also the main vital thing with our medicine, because our medicine is there because medicines like herbal medicines, like you can take turmeric, as I have said, then kutaj is there, then again our very shatavari is there. These medicines which just make as the patients come with the ulcer in the lining, maximum of the patients with endoscopy reports come with the large ulcer in the antrum or the pylorus. First, those patients with the ulcer formation, the first prior treatment will be how to heal that ulcer and to immunize the patients who are suffering from stomach cancer. Okay, so the patients, obviously, the patients who are suffering from stomach cancer, they won't be healed, because as their immunity is also going down, the ulcer won't be healed as their immunity is going on. Yes, we have to give the rasayan therapy to them, because immune therapy with the medicine, the rasayan therapy with the like amlaki is there, chawanprash is there. Those medicines, those herbal medicines, they have immense effect on the immune system, which helps in the prolonged nurturing of ulcer which is there in the stomach lining. And yes, and the medicines which we give, which we advise to the patients, like ashwagandha and other medicines, they they have the immune system, they just immune protective, and also they just वो क्या करते हैं, वो जो ट्यूमर सेल जो होता है या फिर जो अल्सरेटेड एरिया जो होता है स्टमक में ड्यू टू द कैंसर, वो हील करता है और वो जो वो बढ़ने से रोकता है हम लोग का आयुर्वेदिक मेडिसिन. ओके, this is, and first that's why the 3 steps should be there during the treatment of any the stomach cancer. First, there should be health maintenance with the diet. Next comes the rasayan chikitsa. It means rasayan management, like with the immune protective medicines, herbal medicines, ashwagandha, shatavari, then shatpushpa, every in our ADS medicines, these products are there to, these herbal plants are there to immunize the patient's body and to fight with the cancer and to fight with the ulcerated, जो अल्सरेशन है उसको फाइट करने का और जो इम्यूनिटी देने के लिए, because our immune system is there to fight with the cancer. Our immune system has the power to fight with the cancer, to fight with the disease which or she is about.
Sir, coming to you,
Yes.
I have a question regarding glutamine. Like what we said कि cancer में inflammation बहुत है. Coming to stomach cancer as well, हम actually जब हम mucositis वगैरह है तो उसमें हम glutamine recommend करते हैं. ये mucositis के अलावा भी glutamine का रोल है बॉडी में और कहीं पे काम करने के लिए, आपका टेक इस पर चाहिए था.
No, we don't use glutamine as an anti-cancer agent. Of course, we can use glutamine.
No, sir, as anti-inflammatory drug. As anti-inflammatory, like mucositis वगैरह में अगर problem है, तो वैसे ही अगर अंदर inflammation कहीं है, is it going to work on it?
Yeah, what we use, the only thing in clinical practice where we use glutamine is probably in patients who need supplemental products. That is the only scope as far as we see in our routine clinical practice. Otherwise, we don't prescribe glutamine to most of our patients.
Because I have my experience, मैं एक CRP एक patient का था जिनका CRP बढ़ा हुआ था और उनको बोन में जैसे क्योंकि आपका सॉफ्ट टिश्यू और बोन्स पे आपका स्पेशलाइजेशन है इसलिए मैंने ये क्वेश्चन किया है क्योंकि मैंने उनको ही ग्लूटामिन रेकमेंड किया था बिकॉज सेइंग दैट कि इन्फ्लेमेशन इससे कम होता है एंड इट एक्चुअली वर्क विद दैट पेशेंट. तो इसलिए मुझे ये जानना था कि ये होता है या वो बाय चांस कुछ हुआ था.
No, I wouldn't know that. I'm not an expert in it. But then in clinical practice, we don't often prescribe glutamine unless as a supplement in certain patients.
Acha, how much is the person with ulcerative colitis prone to have cancer, stomach cancer?
No, ulcerative colitis is a disease of colon. So it's part of the inflammatory bowel disease.
पेप्टिक अल्सर वाला जो पेशेंट है जहाँ पे एसिडिटी बहुत है और इस तरह की चीजें.
Okay. So gastric ulcers are more, whenever we find a gastric ulcer on endoscopy, we have to treat it seriously because gastric ulcers are mostly related to malignancy, unlike duodenal ulcers. So if you find a gastric ulcer in endoscopy, you have to mandatorily do biopsies. And if it comes out as malignant, then you have to treat the disease. So you cannot leave gastric ulcers without a biopsy. You have to evaluate properly.
So they are quite prone to have that cancer problem.
Yes, yes. This is unlike the case of duodenal ulcers. Duodenal ulcers may be related to acid peptic disorders.
One thing more, as per, because I am the dietitian and what we practice here is that we don't prescribe milk to the patient who is having stomach cancer because we say that milk should not come in direct contact with the cancer cells. Your take on that? क्योंकि मैंने भी जहाँ भी काम किया है, I have been at Leelavati and Saifi for 10 years and there we used to practice milk with each and every patient. तो वहाँ पे तो म्यूकस भी बन रहा है तो भी हम पेशेंट को, बल्कि पेशेंट के रिलेटिव बोलते थे मैडम मत दीजिए दूध, उनको बहुत कफ बन रहा है. But we used to say कि milk is a complete food. If patient is not having anything, we can go with it. But here in Ayurveda, we have that restrictions.
So
have you come across any of such kind of cases?
So I believe in modern medicines, it should be a conglomerate of lot of specialties. So even in oncology, it's not one doctor who decides the treatment or the entire thing. So we are fortunate to have a dietitian, and not only one dietitian, there are many other dietitians in our institute, specifically for pediatric. There are pediatric dietitians. They take care of the nutrition part. They are the experts in this subject. So if we have got any doubts, we definitely follow whatever they advise.
Okay. Okay, sir. Madam, आपका क्या take है इस पर? Milk should be given or should not be given? Because here in Ayurveda,
I would like to intervene here.
Yeah.
So often, it's until something is proven beyond doubt. So it should not be like we counsel patients to avoid too many things because cancer patients are usually malnourished. So if you put too many dietary restrictions, they will end up not getting the required calories or required nutrients. So we should be careful in advising dietary restrictions in cancer patients.
So we do that, and I have seen very good results restricting milk with such patients because I have been practicing here for past 10 years. And before that, I have been at Leelavati for 10 years. So I know modern medicine the same way as I'm knowing Ayurveda. So I combine both of it in my diet plans and all. And I have seen very good results if we restrict, especially in esophageal cancer or stomach cancer or even mouth cancer. If we restrict this milk product, like direct contact with the milk products, I have seen good results with it.
Okay.
So that is my practice of 10 years, but that is my experience basically. So that's what I was asking, whether you have come across such kind of cases or not.
No,
because what we are practicing is a little different thing here. Yeah.
Okay. As a clinician sitting in the OPD, I will mostly not recommend restricting too many things, but then our dietitian would counsel further.
Correct, sir. So you're because you have to leave, I think. So
Yes,
your
sir.
last, yeah, you have to leave. It's almost the time. So in your last words for to prevent such kind of cancers.
You mean gastric
What would
cancers?
Both of cancers or any kind of cancer. Basically, we have talked about pancreatic, stomach, and lung cancer, but what should be like what I have seen and the CMEs which I have done with so many doctors, हम सब ने एक ही बात की है और सब में बाद में ये पता चलता है कि it's now cancer is like a pandemic and it is because of the lifestyle disorders.
True.
तो एक्चुअली क्या होना चाहिए, मतलब ये सचमुच में अब जेनेटिक्स से ज्यादा लाइफस्टाइल डिसऑर्डर हो गया है और हमको क्या करना चाहिए कि हम किसी भी तरह के कैंसर से बच सकते हैं?
Okay, so I will answer it very objectively. So whenever we look into preventing cancers, we should look into the causes. So among the causes, there will be many modifiable risk factors and some non-modifiable risk factors. Non-modifiable, we cannot do anything. But whatever modifiable risk factors, we should definitely walk towards minimizing those risks. For example, in lung cancer, we know that 85 to 90% are due to cigarette smoking, cigarette or bidi or whatever smoking forms of tobacco. So you avoid it. So not only the first hand smoking, the second hand smoking also. If someone in your family is smoking, you tell the person to stop. Then for someone who is already smoking, you ask him to quit smoking, because it has been seen that if you quit smoking, the incidence of lung cancer will decrease. The risk will decrease. So don't develop the habit, and if you have developed the habit, quit it. Then the third thing, it is difficult in today's age is to avoid environmental pollution. That is one thing that has to be worked at a higher level, like in a government level.
Exactly.
Then that will solve most of the lung cancer problems. But when we come to gastric cancer, like we told, avoid the high-risk behaviors like eating unhygienic food. It is through unhygienic food and water that you acquire the Helicobacter pylori infection. So that is one thing that can be addressed. Second thing is you avoid the smoke and salt-cured pickled food. That will go a long way in decreasing the risk. And coming to pancreatic cancer, avoid alcohol. That is a known risk factor. And there are many other cancers. If we go on seeing the risk factors for most of these cancers, it would boil down to tobacco and alcohol. So these are things, substance abuses, which need to be addressed. Especially in head and neck cancers, is mostly tobacco driven only. If we stop the tobacco industry, the head and neck cancers may even disappear.
Thank you so much, sir. You have been very kind in answering all such questions. बहुत सारे questions मेरे ऐसे भी थे जो मुझे ही नहीं पता थे, and you have explained each and every word. Thank you so much for being with us.
Thank you so much.
Thank you, sir. Coming to Dr. Priyanka. पैंक्रियाटिक कैंसर के रिस्क फैक्टर्स पे हम लोग बात कर रहे थे. अगर किसी का पैंक्रियाटिक कैंसर है और पेशेंट फिर भी डायबिटिक नहीं है, जैसे आपने ABCD बताया है उसका कि ये चीजें होनी चाहिए ना. अल्कोहल, अगर कोई पेशेंट है जो अल्कोहल नहीं लेता है, बॉडी वेट ठीक है और डायबिटीज नहीं है, फिर भी उनको पैंक्रियाटिक कैंसर है, मतलब इनफैक्ट कोई भी गलत आदत नहीं है, बट दैट पेशेंट हैज डेवलप्ड दैट, तो और ओबीज भी नहीं है, तो फिर क्या रीजन हो सकता है उसका? और अगर फैमिली हिस्ट्री भी मतलब जितना पता करने पे नहीं है कि फैमिली हिस्ट्री भी कभी नहीं रही है, तो फिर अब ये पांचवा कौन सा फैक्टर हो सकता है इसका?
पांचवा फैक्टर तो एक सेडेंटरी लाइफस्टाइल हो सकता है. सेडेंटरी लाइफस्टाइल, क्योंकि अभी क्या है, सोशल मीडिया का जमाना है. हाँ, सोशल मीडिया का जमाना है. अभी सब लोग वर्क फ्रॉम होम वो है, घर बैठे सब हो जा रहा है सब कुछ. तो क्या है, एक गिलास पानी के लिए भी किसी को उठना नहीं पड़ता है. तो घर पे अगर कोई है, अगर कोई मतलब हेल्पर है कोई, तो उनको बुला के हो जाता है. तो वैसे क्या होता है, किसी का नहीं है डायबिटीज, ठीक है, लेकिन किसी को वो ओबीज भी नहीं है, वो ओवरवेट भी नहीं है. कोई इश्यूज नहीं है, फैमिली हिस्ट्री में भी ऐसा कोई नहीं है। लेकिन ये जो लाइफस्टाइल जो मतलब डिसऑर्डर जो है लाइफस्टाइल, क्योंकि एक सिडेंटरी लाइफस्टाइल भी एक डिसऑर्डर के आता है, ठीक है, अभी इन दिस जोन। तो वो क्या होता है, वो एक मतलब पेनक्रियाटिक कैंसर होने का, क्योंकि अभी हम लोग अगर चिप्स खाते रहते हैं वो सोच के कि हम लोग का अभी डायबिटीज नहीं है, नहीं होगा, हमारे फैमिली में नहीं है तो नहीं होगा। अगर हम चिप्स खाते रहते हैं, टीवी देखे, नेटफ्लिक्स देखे, खाते रहेंगे, तो वो क्या होता है, प्रोलॉन्ग एक चीज करने से वो ऑब्वियसली हेल्थ को एक इफेक्ट करेगा। वो जो धीरे धीरे वो जैसे पेनक्रियाटिक कैंसर हो, स्टमक कैंसर, ये सब धीरे 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 एक चांसेस हो जाता है। क्योंकि एक डैमेज, मैंने जैसे बोला है डेफिनेट आपको पेनक्रियाटिक कैंसर के बारे में, एक जस्ट सिंगल डैमेज टू दैट ऑर्गन कैन लीड अ बिगर डैमेज टू द होल बॉडी। एक सिंगल थोड़ा सा भी चोट एक ऑर्गन में होल बॉडी को हिला दे सकता है।
बिल्कुल।
ठीक है, तो वही हम लोग का जो एक सिडेंटरी जो लाइफस्टाइल है, अगर हम लोग सोचे कि हम लोग का कोई हिस्ट्री नहीं है, फैमिली हिस्ट्री नहीं है हाइपरटेंशन का, डायबिटीज का, फिर भी हम लोगों को एक लिमिट में रहना चाहिए। एवरीथिंग शुड बी इन लिमिट। मतलब ठीक है, चिल करना है, नेटफ्लिक्स देखना है, सोशल मीडिया, इट्स ओके, एवरीथिंग इज गुड, बट चिप्स ये सब भी खाना, थोड़ा उठ के एक्सरसाइज करना, प्राणायाम करना, थोड़ा एक जो डेली लाइफस्टाइल है वो मॉडिफाई करना जरूरी है। वही एक लाइफस्टाइल मॉडिफिकेशन भी, लाइफस्टाइल डिसऑर्डर भी कैन लीड टू कैंसर। क्योंकि कैंसर अभी नॉन कम्युनिकेबल डिजीज के एनसीडी में बहुत ऊपर आ गया है ये कैंसर भी। हाँ, तो वो इट कैन अफेक्ट एनीवन इन एनी एजेस। ठीक है, तो ये लाइफस्टाइल मॉडिफिकेशन बहुत जरूरी है अभी अभी इस टाइम में।
हाँ, यही तो मतलब अभी डॉक्टर दास भी यही कह रहे थे कि अभी ये तो बेसिकली अब हमको ये समझना है इसका मतलब कि अगर लाइफस्टाइल ठीक है तो कैंसर नहीं होगा, लाइफस्टाइल ही गड़बड़ है तो कैंसर किसी को भी हो सकता है। और सबसे बड़ा उसमें आता है
हाँ,
पोर्शन
अगर
डाइट पार्ट का, कि हमारा डाइट क्या है। आजकल स्विगी हर किसी के हाथ में है, खाना घर पे नहीं बनाना है, स्विगी ऑर्डर करना है तुरंत।
हाँ,
तो
ऑर्डर
सबसे
करना है।
बड़ी चीज जो वाकई
हाँ,
में दिख रही है वो ये है कि घर का खाना हम खाना ही नहीं चाहते हैं और लोग बनाना नहीं चाहते हैं। सबसे चीज अच्छा,
हाँ, वही तो।
हाँ, ये बहुत बड़ी चीज है, क्योंकि मैंने जितना देखा है, मैं हर जगह बोलती हूँ कि
हाँ,
सुबह उठ के खाली पेट चाय मत पीजिए। जो हम यहाँ बिलीव करते हैं डीएस रिसर्च
हाँ,
सेंटर में, हम लोग ये बोलते हैं एसिडिटी बॉडी में बढ़ेगी तो कैंसर बढ़ेगा। और आपका सुबह का चाय सबसे ज्यादा एसिडिटी बढ़ाता है, बट 99% लोग तो चाय पीते ही हैं। डाइटरी मॉडिफिकेशन भी तो उतना ही जरूरी है जितना आपका लाइफस्टाइल मॉडिफिकेशन जरूरी है। सुबह उठ के हम बेड टी लेते हैं, उसके बाद हम प्राणायाम नहीं करते हैं, सारे दिन क्लोज एनवायरनमेंट में है जहां हमको ऑक्सीजन नहीं मिल रहा है। कैंसर होने के बाद एंटीऑक्सीडेंट लेने का क्या मतलब रह जाता है अगर हम प्राणायाम नहीं कर रहे हैं। तो मैं ये पूछना
वही।
चाह रही थी कि एक्चुअली लाइफस्टाइल मॉडिफिकेशन जो करना है तो एक नॉर्मल रूटीन क्या होना चाहिए। जैसे आपके आयुर्वेद में दिनचर्या, ऋतुचर्या सब बताई जाती है, तो व्हाट शुड बी द
हाँ,
परफेक्ट लाइफस्टाइल फॉर अ पर्सन टू बी हेल्दी।
फर्स्ट ऑफ ऑल सुबह उठ के एकदम हम लोग ब्रह्म मुहूर्त जो है हम लोग का आयुर्वेद में बोला है ब्रह्म मुहूर्त में उठने के लिए। सो ठीक है, अभी ये पॉसिबल नहीं है, सब लोग पॉसिबल नहीं है ब्रह्म मुहूर्त में उठना, लेकिन ट्राई करना है अर्ली मॉर्निंग उठने का। वही, तो अर्ली मॉर्निंग उठिए, एक वॉक पे जाइए, सुबह उठने के बाद ड्रिंक 1 ग्लास ऑफ लीकवार्म वाटर, मिनिमम 1 ग्लास पानी पीजिए लीकवार्म वाटर। अगर उससे भी अच्छा होगा अगर पहले दिन, जैसे अभी ठंड का टाइम चल रहा है, तो वो एक ठंड का टाइम चल रहा है और ज्यादा ठंड भी आएगा अभी दिसंबर जनवरी में, तो एक काम कर सकते हैं, एक पहले मतलब रात में 1 ग्लास पानी में, अच्छे पानी में 1 चम्मच मेथी दे के भिगो के रख दीजिए, 1 चम्मच पानी में, जिसको हम शीतल बोलते हैं, आयुर्वेद में हम लोग शीतल बोलते हैं, मेथी शीतल। तो वो कर सकते हैं, 1 ग्लास पानी में 1 चम्मच मेथी भिगो के रख दे, फिर सुबह उठ के वो वाला पानी आप अब सीव करके से मतलब वो अच्छे से पानी निकाल के वो पानी पीजिए। वो आपके बॉडी को जो इम्यूनिटी चाहिए ठंड के टाइम, जो ठंड लगता है वो इम्यूनिटी जो चाहिए ठंड के टाइम वो देगा, प्लस आपको जो बाकी रोगों से भी बचाएगा वो, क्योंकि वो एंटी इन्फ्लेमेटरी है, एंटीऑक्सीडेंट है, उसमें भरपूर मेथी में होता है, मेथी के सीड्स में, मेथी के पत्ते में। ठीक है, वो कर सकते, वो पानी पी के एक वॉक में जाइए, एक थोड़ा सा वॉक कीजिए, वॉक करके थोड़ा चल के एक मॉर्निंग वॉक करके आइए थोड़ा। फिर आप एक आपको अगर अच्छा लगता है, एक टर्मरिक खाइए, रो टर्मरिक, छोटा सा एक टुकड़ा रो टर्मरिक खाइए। रो टर्मरिक के बाद जो आपका ब्रेकफास्ट है, और एक बात, एक खाने के बाद इधर इट इज मतलब ये टर्मरिक ही हो या फिर आपका ब्रेकफास्ट हो या फिर मेडिसिन हो, आधा घंटे का गैप देना चाहिए, क्योंकि हमारा बॉडी है ये कोई डस्टबिन भी नहीं है कि हम लोग देते जाइए वो हजम करके जाता है, वो नहीं होता है। हम लोग को बॉडी को भी टाइम देना चाहिए उसको काम करने के लिए। वही तो खाने के बाद फिर एक टर्मरिक खाने के बाद थोड़ा रेस्ट दीजिए बॉडी को। फिर अगर आपका कोई मेडिसिन है, जैसे थायराइड का मेडिसिन होता है, फिर ऐसा कोई खाली पेट में खाना होता है, वो खाइए। उसके बाद फिर जैसे ब्रेकफास्ट होता है, ट्राई टू हैव अ गुड ब्रेकफास्ट। मैं वही बोलना चाहती हूँ, ट्राई टू हैव अ गुड ब्रेकफास्ट, कि ऐसा नहीं चाय पी लिया और एक ब्रेड खा लिया। ऐसे भी पेशेंट्स आए हैं, बोले हैं कि चाय पी लिया, ब्रेड खा लिया। वैसे नहीं होता है ब्रेकफास्ट, इसको ब्रेकफास्ट नहीं बोलते, तो स्नैक बोलते हैं। इवनिंग स्नैक या फिर मॉर्निंग स्नैक ठीक है, पकड़ सकते हैं इसको, लेकिन ये ब्रेकफास्ट नहीं है। ब्रेकफास्ट शुड बी अ गुड एंड हैवी वन। ठीक है, इतना हैवी नहीं खा सकते, बट शुड बी अ गुड एंड न्यूट्रिशियस वन। तो ब्रेकफास्ट डालिया है, कितना है वो, कितना अच्छा खाना है हम लोग के यहाँ। नेचर ने इतना सादा खाना दिया है खाने के लिए, चाय और ब्रेड के अलावा। तो वो खाने खा के फिर आपका दिन शुरू कीजिए। फिर मॉर्निंग स्नैक में एक कोई भी एक सीजनल फ्रूट्स खाइए, जैसे अभी ऑरेंजेस निकला है, अच्छा इस सीजन में ठंड के समय में ऑरेंजेस निकला है, एक खाइए एवरी डे। तो एक एक करके फ्रूट्स खाना चाहिए। देन अगेन हैव योर लंच विद इन 12 to 1 PM, ये अच्छा टाइम होता है। एंड ट्राई टू हैव द डिनर बिफोर तो वो तो पॉसिबल नहीं होता है, क्योंकि अभी सब वर्किंग है, अभी आते हैं 7 बजे। तो ठीक है, मिनिमम करना चाहिए कि हम लोग अगर 10 बजे सोते हैं, तो ट्राई करना है 7 बजे डिनर खत्म करने के लिए। 6:30 से 7 बजे डिनर खत्म करना है, क्योंकि अगर हम लोग को 10 बजे सोना है, तो 3 घंटे के पहले खाना खत्म करना है, डिनर। और वही है, खाना खा के ही, डिनर करके ही सोना नहीं है, क्योंकि वो हम लोग का होता है खाना खा लिया, अभी बेड, अभी सोना है नहीं, थोड़ा चलना है। हम लोग के आयुर्वेद में बोला है कि 1000 स्टेप्स लेना होता है खाना खाने के बाद। हमारे क्लासिक्स में ऐसा है कि हमारे किताब में है कि हमारे आचार्य ने बोला है कि 1000 स्टेप्स, यू शुड टेक 1000 स्टेप्स बिफोर गोइंग टू बेड एंड आफ्टर टेकिंग फूड। तो वो करना है। तो फिर टाइम में वही एक टाइमिंग होना चाहिए खाने का, सोने का, एवरी शुड हैव अ टाइम मैनेजमेंट करके, मतलब
The main
खाना
thing,
मेडिसिन सब कुछ एक टाइम,
exactly, the
everything will be
main
good
thing
and
in the lifestyle is controlling your time. The time management is the basic thing what we should follow. जहाँ जैसे कि मैं बोलती हूँ कि आपको अगर अपना सारा रूटीन डिवाइड करना है, सो डोंट बी एम्प्टी स्टमक फॉर मोर देन 3 hours. हर 3 घंटे पर कुछ ना कुछ ले लीजिए. इट्स नॉट अबाउट होल फूड, लेकिन आपको उस वक्त खाली पेट नहीं रहना है, बिकॉज दैट एसिड विच इज सिक्रेटिंग इन योर बॉडी एट अ पर्टिकुलर टाइम, इट नीड्स फूड टू वर्क ऑन. नहीं तो फिर वही वो गैस्ट्रिक अल्सर और पेप्टिक अल्सर की प्रॉब्लम होती है, एंड विच अल्टीमेटली लीड्स टू दिस काइंड ऑफ कैंसर एज वेल.
वो जो प्रोलॉन्ग, जो एक खाली पेट रहते हैं, प्रोलॉन्ग जो एम्प्टिंग ऑफ स्टमक जो रहता है, दिस इज आल्सो वन ऑफ द प्राइमरी फैक्टर्स ऑफ स्टमक.
एग्जैक्टली.
अल्सरेशन होता है ना, जो एसिड फॉर्मेशन में क्या होता है, एक अल्सर व्हिच लीड्स टू अल्सर फॉर्मेशन इन द स्टमक. और वो अल्सर जब जाता है पेशेंट, वो उनको कुछ फर्क नहीं पड़ रहा है, पेन भी ज्यादा नहीं, बट अल्सर बढ़ रहा है, वो बाद में क्या होता है, which it turns to cancer, stomach cancer. तो वही खाली पेट ज्यादा टाइम नहीं रहना चाहिए.
So basically it is a lifestyle modification plus dietary modification. Stick to the time of the food, the quality of the food, quantity of the food. I think that is the basic thing which we should rely on, and we can get rid of such kind of cancers as well. We had a very elaborative and very informative talk today, and we had Dr. Das with us. So coming to the closer, we are on the closing note. So every life we save begin with knowledge. Awareness campaigns empowered individual to make informed choices, turning fear into action and despair into hope. That is what we are trying to do with the webinars and different kind of events we are conducting, the different kind of awareness programs we are conducting. So this November, recognized as Cancer Awareness Month, we reaffirm our mission to change lives with the timeless principle, and then that is early action makes all the difference. अभी भी अगर हम ये समझ जाएं कि हम कहाँ गलती कर रहे हैं और वो गलती अगर हम सुधार लें तो शायद हम इस तरह की बीमारियों से बच सकते हैं. Cancer is not a death sentence now. Here in DS, we believe that cancer is not a death sentence. We have seen a lot of people being cured of this. When caught early, it's a battle we can win. Through our network of clinics, we are not just treating cancer, we are creating awareness, spreading hope, and inspiring action. Together, we can make earlier diagnosis the norm, improve survival rates, and build healthier society. Together, we can save lives, and we are doing it from the very first day since I joined. And day by day, people are joining us. People are getting cured with any kind of cancer. Here, with my 10 years of experience, I have seen liver cancer being cured, brain cancer being cured. So I believe that cancer is totally curable. It's only your lifestyle and your dietary modifications plus the medicines which we provide here at DS Research Center, which are pure antioxidant medicines based on the principle of ancient Ayurveda of nutrient energy. And I think we have been able to give much more knowledge to the listeners who are here. Thank you, Dr. Priyanka, for being here, and we have a very good and informative talk. Thank you for being here. So thank you so much. I think we can end up here. Thank you so much. Bye-bye.
Thank you.